ఈరోజు మనతో ఆక్యుపంక్చర్ సైన్స్ ద ఓల్డెస్ట్ అండ్ అన్ ఏన్షియంట్ ప్రూవెన్ హెల్త్ సైన్స్ గురించి మాట్లాడడానికి డాక్టర్ దీపక్ రౌట్ పిహెచ్డి గోల్డ్ మెడలిస్ట్ ఇన్ ఆక్యుపంక్చర్ సైన్స్ అండ్ ఫౌండర్ అండ్ సిఇఓ హోలిస్టిక్ మెడిసిన్ రీసెర్చ్ ఫౌండేషన్ గారు ఉన్నారు. మరియు వెల్కమ్ సార్, వెల్కమ్ టు అవర్ మెట్రో studio.
Thank you very much.
Sir, tell me about acupuncture process.
Acupuncture, it is a powerful holistic science. Holistic, the mean is where we can indicate the whole person. We can treat the whole person. So acupuncture has the great challenge and the great impact on the human body. So once anybody undergone the treatment, the acupuncture will take care of the whole body. It is a very old science. It's long back 5,000 years ago, and it really discovered in India and developed by the China. And acupuncture, it is a mix of two words. Acus means needle and the puncture means it is the art of pricking. So we have to select some of the fine needle and to prick on the pre-located points, then the result will come, and it is known as acupuncture. And what the acupuncture will do once you prick it will balance, it will remove the stagnation, and those kind of mechanism will start. Then we can get all these health related issues, and we can solve all the chronic, all the cases actually. So if we talk about our Indian history, and very long back, and it was started in India, and slowly it migrated to the China. Now the acupuncture is spread and throughout the world, and that is also amazed like that 1/3 population, and they are taking acupuncture. It is the report from the 2008. So you can imagine from the 2008 report, in 1/3 population they are taking acupuncture treatment throughout the world actually. And just recently we can say in the Telangana state also, and there are a lot of development is going on, and lot of good doctors they are practicing, and we are trying to very hard and how to recognize this science in Telangana state.
Sir, tell me, is it a modern therapy or traditional one?
This is really purely traditional. And why traditional? Because it heals from the root. Modern science which will treat the symptom, not root actually, but traditional science always to heal the root, and acupuncture impact is like that, always it heal and cure the patient from the root.
ఓకే సార్, మీరు నాకు తెలిసిన విధంగా ఇది ఒక కొన్ని వేల సంవత్సరాల క్రితం నాటి సైన్స్ అని చెప్తున్నారు. మరియు ఇండియాలో అతిపెద్ద ఆక్యుపంక్చర్ క్యాంప్ నిర్వహించినందుకు మీకు ఇండియన్ బుక్ ఆఫ్ రికార్డ్స్లో స్థానం సంపాదించినందుకు కంగ్రాచులేషన్స్ సార్.
థ్యాంక్ యూ వెరీ మచ్.
మరియు వీటి వల్ల ఎలాంటి స్పెషలైజేషన్స్ ఆక్యుపంక్చర్లో ఉన్నాయి?
See, acupuncture, it depends.
Specialties.
It lot of specialties there, and if you talk about metabolic disorder, if you talk about neurology, and neurology, that is also two branches: autonomic nervous systems and central nervous systems, and all kind of skin diseases also, and in metabolic also we can say like the BP and diabetic, and this kind of and obesity, and so paralysis. So it has lot of specialization in acupuncture, and through the impact of the natural healing procedure, so we can give good health to the society through any kind of procedure actually.
Okay sir, from this acupuncture science, what are the disorders can cure?
See, it is a very tough questions, and to doctors also and to all the society people. So according to my experience, so I can say I have tried all the chronic and acute. So first upon, acupuncture will very good mechanism on the acute and chronic diseases. So we have to think about the chronic disease. So when it is chronic disease, like you can say the insomnia and infertility. So a very good support for the infertility also. And those patients, they are trying the IVF, so IVF actually. So before IVF, if they will try the acupuncture, so the impact is there and the positive result they will get it. And apart from like the neurological disorder and the migraine and the chronic headache and the eye problems also, some of the problem which cannot be cured through otherwise from the modern science actually, the facial tic we can say, and the facial paralysis. So and the ankylosis spondylosis and the disc bulging and the back pain, which upper back pain, lower back pain, and the frozen shoulders and the chest pain, chest heaviness, so BP and diabetic, and the constipations and the asthma. So asthma also is getting very good response and tremendously patient are getting good result, and that to be permanent actually. So apart from the obesity, and the most important part is the hormones, because it has good mechanism to balance the hormones. Apart from the paralysis and the foot drops and the wrist pain. So and the side effect of the cancer also, that also totally curing, and like that so many chronic diseases responding well through the acupuncture.
ఓకే సార్, మన డాక్టర్ గారు చెప్తున్న విధంగా ఒక తలనొప్పి నుంచి మరియు మడమలు, చేతి కీళ్ళ నొప్పులు మరియు బ్యాక్ పెయిన్ నొప్పులు కూడా ప్రతి ఒక్క ఏదైనా ఒక డిసీజ్ ఉందంటే అది ఆక్యుపంక్చర్ సైన్స్ నుంచి నయమవుతుందని డాక్టర్ గారు చెప్తున్నారు. మరి అలాగే సార్, టెల్ మీ, ఇన్ ఆక్యుపంక్చర్ సైన్స్ ట్రీట్మెంట్ a patient can allow to continue their previous medicines?
Yes, obviously, because before coming to acupuncture treatment, I think mostly somebody they will use allopathic, somebody they will use homeopathy and Ayurveda. So in acupuncture there is no side effect and no contraindication to other therapy. And even if acupuncture some of the part is like that homeopuncture, it is the some of the part actually. So we can combinely also homeopathy acupuncture, we can also give the treatment for the specific disorder, and Ayurvedic homeopathy also. Some of the Ayurvedic medicine we have to select, and apart from acupuncture also. So first upon those patients, they are taking the medicines, and apart from the traditional medicines and we should talk about the allopathic medicine, those who are habited addiction with the allopathic, because neither, if you talk about diabetic, so long back 20 years they are taking the allopathic. Acupuncture has good impact, within few days the sugar level can be normal, but it is a body response, because already you are taking the long year back actually. We should not stop the medicines, we have to observe first. Okay, we can reduce the dose. Okay. Always when you start the acupuncture, any format of chronic disease, so we should not stop immediate the medicines, the withdrawal side effect will start. Okay, so we have to always measure. So once, if we talk about the BP patient, they are taking the medicines. So once you undergone the acupuncture treatment, you have to measure morning and evening how the BP is controlling. If the BP is really giving the fantastic result, then we can reduce the dose, not withdraw. Withdraw when the acupuncture will be resistance to your body, then we can plan for withdrawal. Even if after also you have to check.
Okay. Sir, ఇది చెప్పండి, ఆక్యుపంక్చర్ ట్రీట్మెంట్ ఎంత టైం తీసుకుంటుంది? How much time it will take?
It depends upon the case and severity, and from minimum 10 minutes up to 30 minutes we can decide, depends upon the case.
Okay, minimum 10 minutes.
Minimum 10 minutes.
Okay, sir. How can a disease cure through acupuncture?
there are lot of diseases and which can cure, and it is pure depends upon the acupuncture mechanism. So if you are asking about the mechanism, so I can in a very simple format I can say, which everybody can understood the concept. Suppose just you got the fever,
Okay.
and you took the paracetamol.
Yes.
What the paracetamol is doing the mechanism? First questions. Okay. So when you took the paracetamol, it's just going to the stomach, and with the water also you are taking. So it will take 30 minutes to dissolve the paracetamol. So after dissolve, you know the chemical will be evaporate. Then it's come to the bloodstream. Okay. So when it come to the bloodstream, then it inhibit COX-1, COX-2.
Yes.
Some chemical is there. Then after the action will start, then you won't feel any pain, and the temperature will be reduced. So it means the outer chemical giving you result, or we can say some kind of suppression. Okay. Suppose you are in high fever, immediate we can suppress the fever, right? So this is the outer chemical. So when you talk about the acupuncture, it is a inner chemical. Where it is the inner chemical? What kind of? Because when the child is born, no need to give anything, because God has given all this impact, all this power. It is called as a natural healing system through the human body, and all the chemical are there actually. We call as a hypothalamus area. In hypothalamus area, lot of chemical, it is storage house. Okay. What the acupuncture is doing to stimulate through the specific point, through the meridian channel, and all the hormone will be released. Suppose if you talk about the pain, so how the acupuncture will cure the pain actually. So we have given the specific point, those point ability to release the endorphin, and those endorphin will be released from the hypothalamus and coming to the bloodstream. Then the action will be start. Same the endorphin also, again the blockage of the COX-1, COX-2, which we can say if the COX-1, COX-2 are there, then the release of inflammations and the pain, body pains, like that. So same we are acupuncture trying to release all the inner chemical, and apart from other system we are taking the outer chemical. This is the basic difference and mechanism.
Okay, sir. In this acupuncture treatment, needles can be used?
Yeah, very fine needle, and in 1996 Food and Drug Administration, they have approved the sterilized needle can be used single.
Okay.
Okay. So only the sterilized good quality needle we have to use. So we have to use only single.
How many needles can be used in single treatment?
So it depends upon the again case. So we can say for one needle to again up to we can extend up to the 15 needles. Some case, very acute case also we can select, and with the only one single needle also we can cure some disease. It will go up to the 15 needles.
మరి మనకు డాక్టర్ గారు చెప్తున్నట్టు నీడిల్స్ ఇన్సర్షన్ ద్వారా మనిషి యొక్క బాడీని యాక్టివేట్ చేస్తూ హార్మోన్స్ రిలీజ్ అయ్యే విధంగా బాడీని మరి మన ఆధ్వర్యంలోకి తీసుకొస్తూ ఏవైతే డిసీజెస్ రోగాలు ఉన్నాయో వాటిని నయం చేయడానికి ఆక్యుపెంచర్ సైన్స్ ద్వారా మేము ప్రయత్నిస్తున్నాం. ఇది దీంట్లో స్పెషాలిటీ అని చెప్తున్నారు. మరి చెప్పండి సార్, ఈ నీడిల్ ఇన్సర్షన్ పాయింట్స్ ఎక్కడెక్కడ ఉన్నాయి, ఎక్కడెక్కడ ఉంటాయి హ్యూమన్ బాడీలో?
So this is a very good questions, and all the acupuncture points, which is we can say all the nerve ending, and those nerve ending that is called as a specific point, it contain the high biomagnetic field, and through the biomagnetic field it will stimulate and go to the meridian channel and activate all these hormones, or activate and balance your homeostasis, and we can release the hormones and activate all the nerves. So it is in superficially under the skin, all these points are situated, and just nerve ending. It is not like that the point is going to the muscles and point is going to the bones, not like that. It is just touching the nerve ending, and due to that point, so all the mechanism we are getting, and all the incurable disease also can cure through that mechanism.
Okay. By activating nerves, you are going to treat entire total body.
Yes.
ఓకే సార్, అది మరి డాక్టర్ గారు చెప్తున్నారు నరాలను యాక్టివేట్ చేస్తూ బాడీని కంట్రోల్లోకి తెచ్చే విధానం పాటిస్తున్నామని చెప్పేసి. సార్ ఇంకొక విషయం ఏంటంటే ఈ అక్యుపెంచర్ ప్రాక్టీస్లో ఏదైనా అసోసియేటెడ్ థెరపీస్ ఏమన్నా ఉన్నాయా దానికి రిలేటెడ్?
Yes, and that is why in US government also they started with through the government National Center for Complementary Alternative Medicines. So I think it is a very broad sense and complementary alternative medicines. So if single you are practicing acupuncture, that is called as acupuncture. If it is combined with the allopathic and acupuncture, it is called as a complementary therapy. So I think nowadays major people are liking for the complementary therapy, because single therapy cannot be panacea actually, because sometimes can be failure. So if you want to success your the theory and to give the good health for the society, I think complementary therapy is the best therapy. And not only the medicines, I can say acupuncture and the lifestyle, if anybody can maintain, I think they can get the miracle result. And the lifestyle is a major issues nowadays, people are not following, and people are taking lot of stress, and per day, every day, even if whether it is women and the men they are going outside for the business, they are taking stress, and the women they are maintaining the total inside the house, they are also getting stress is there. But how you are able to remove? No. If somebody will ask about, please do some yoga and meditation, everybody is saying no, I don't have time. By watching the TV there, it is good actually, but practically there it is not.
They have no
time to do actually. So everybody they can say no, I don't have time. So there is so many of the therapies like that to reduce the stress, if you talk about Reiki and meditation like that, but people simply they will say I don't have time. But I can say if somebody is undergone one day only acupuncture, the stress level will be go actually. So I will suggest all these IT people monthly once at least try for one session, so the entire body should be relaxed, and they can next month they can take the load whatever. So every day we are working per day and taking all lot of stress, but stress is not going. That is one measure. Second measure is the detoxification. So how much you are detoxify your body? Just we are bathing, if you don't bath one day also, next day you will feel.
Yes.
Just you are bathing superficially, inside are you cleansing your system? No. So we can say these kind of things, if you add on to the acupuncture treatment, I think everybody they can get the fantastic result.
ఓకే, యాక్చువల్గా మరి డాక్టర్ గారు చెప్తున్నట్టు బాడీతో పాటు మనసును కూడా మన కంట్రోల్లో ఉండే విధంగా మనసును కూడా స్వచ్ఛంగా నిర్మలంగా ఉంచుకోవాలి అని చెప్పేసి చెప్తున్నారు. దానికి మరి అక్యుపంక్చర్ సైన్స్ అనేది రిజల్ట్ ఇస్తుందని కూడా చెప్తున్నారు. మరి సార్ చెప్పండి, అక్యుపంక్చర్ ట్రీట్మెంట్లో నీడిల్స్ యూజ్ చేస్తామని చెప్తున్నారు కదా, ఈజ్ దిస్ ట్రీట్మెంట్ కెన్ painful?
No, absolutely no painful. If the patient is very comfortable positions, doctor is comfortable position, so I think there is no absolutely they will get pain. But very rare point, there be some just few seconds they will get the pain. Otherwise 99% there is no painful, and even if there is no blood.
Okay sir, మీరు ఎలా అక్యుపంక్చర్ అండ్ అక్యుప్రెషర్ పాయింట్స్ని డిఫరెన్షియేట్ చేస్తారు?
A few points are different to acupressure, but theory wise both are same. So the meridian channel, it is equal to acupressure and acupuncture, but thing is in acupressure just we have to apply the pressure, okay, and the result is same. But thing is some restriction is there for acupressure, and for acupuncture there is no restriction. Example like the some point which we can there is some measurement for the acupuncture like the 1 chun 2 chun like that. So, if it is so depth, the point is so depth, and we can insert a big needle.
Okay.
So, I think the acupuncture is the best. We can cleverly we can touch that point, but where acupressure sub depth point cannot be activate actually. So, acupressure whatever the superficially, like we talk about the fingers point and feet point, we can pressures, and some of the superficial point we can activate very easily, we can get the result actually, but which the point is very depth we cannot give, because we cannot press too much of hard actually, the patient will feel the pain actually. That is the only difference between the acupressure and acupuncture. And acupuncture, which the World Health Organizations, they have already started the clinical trials. They approved lot of diseases like the acupuncture respond to that disease and cure to that disease like that. So, this is the only the difference between the acupuncture and acupressure.
Okay, sir. About and what are the major differences between allopathy and acupuncture?
So, as earlier I told, only one measure, allopathic treatment depends upon the symptoms and depends upon the investigations. Acupuncture treatment depends upon the pulse diagnosis and it cure from the root cause. That is the only major difference.
Okay, sir. Acupuncture treatment, are you using needles only, or otherwise do you have any subsystems?
Yeah, in acupuncture there are a lot of systems and we are using, and you can say apart from the needle, so without needle also we can give. So, this is called as a stimulation therapy. We will use the stimulation machine, and without stimulation, which is called as a body acupuncture without stimulation. A few cases we have to, like the migraine, for the migraine no need to give any stimulation, with simple acupuncture also we can cure the disease. Apart from there is some cupping therapy. So, we have to place the cups and suction with the pressures, and the point will be activated actually. And in cupping therapy also there are also different modality, simple cuppings and the bleeding cupping. So, we have to bleed the area. So, apart from laser acupuncture, micro acupuncture also there. Micro acupuncture, it is a developed nowadays, very developed. So, micro acupuncture we can use for the eye problems and for the head therapy, and apart from homeopuncture. So, we have to select some of the specific homeopathy medicine and dipped into the needles, and those specific medicines we have to select the specific point and we have to give the therapy, that is called as homeopuncture. And homeopuncture also like that, if the some cases really respond is very less, so then we can use the homeopuncture. So, and apart from the sujok therapy, which is we have to manipulate through the only hand and feet like that, very small needle we have to insert through the palm, and through the palm we can, like you can say it is a kind of reflexology theory actually. So, just if you prick here, your eye problem will be cured.
Yes.
So, this is called as a reflection theory. So, there are like that so many methods and systems are under the acupunctures.
మరి డాక్టర్ గారు చెప్తున్నట్టు అక్యుపంచర్ సైన్స్ అనేది కొన్ని వేల సంవత్సరాల సైన్స్ అని చెప్తున్నారు. మరి అది పురాతన కాలాల నుంచి ఉన్నా కూడా ఇండియా నుంచి వెళ్ళి చైనా దేశంలో అభివృద్ధి చెందినట్టుగా మనకు తెలుస్తుంది. మరి చెప్పండి సార్ డాక్టర్ గారు, ఈ అక్యుపంచర్ సైన్స్, అక్యుపంచర్ ట్రీట్మెంట్ అనేది గవర్నమెంట్తోని రికగ్నిషన్ చేయబడిందా?
Obviously, if you will talk about throughout the world, and then we'll talk about the Indian history. So, first upon World Health Organization, they already approved the science. National Institute of Health, the government of USA, they have also approved. NCCM, National Center for Complementary Alternative Medicines, they also approved. And if you talk about Indian history, and I think some of the state level they approved. So, first state is the West Bengal state, and the West Bengal government approved the acupuncture science, And recently Maharashtra government, they passed the bill to set up the council as well as to develop the acupuncture science. And through the Acupuncture Science Association, one of the biggest network in India, so they have given to the central government to approve the acupuncture science in India. So these are the things state wise, it is going to be approved all the very soon actually. But my request is to all these practitioner, and even if my humble request to the government side, so if they will approve this science, I think the major impact will come to the health sector. You know, the 60% of population which is the poor population, so they will get the excellent result if the government will take some actions regarding the acupuncture.
ఓకే సార్, మనకు డాక్టర్ గారు చెప్తున్నట్టు వరల్డ్ హెల్త్ ఆర్గనైజేషన్ నుంచి మరియు రకరకాల ఆర్గనైజేషన్స్ నుంచి ఆక్యుపెంచర్ సైన్స్కి రికగ్నిషన్ ఉంది. అలాగే తెలంగాణ గవర్నమెంట్ కూడా ఆక్యుపెంచర్ సైన్స్ని ఆదరించి దీనికి ఒక రికగ్నిషన్ ఇవ్వాలని డాక్టర్ గారు చెప్తున్నారు. అలాగే సార్ చెప్పండి, ఈ ఆక్యుపెంచర్ ట్రీట్మెంట్లో యాజ్ ఏ డాక్టర్, what is your achievements and experience?
Achievement, I can say a lot of I did in my career. So I am practicing since 15 years. So I came to Hyderabad 2007. So before I started in Odisha, and in 2007 to and 2017, 10 years completed. So basically, you know, the qualification wise, even if I did my clinical research, and my motto is to incorporate acupuncture science with the clinical research and develop for the human being, and we can say the health and happiness. So everybody they are getting health, but there is no happiness actually, because happiness, where you will get it? If you are really reach to the wellness, because happiness wellness will give you. So how to get wellness? Medicines cannot give you wellness actually. Okay, we can say even if 100% acupuncture cannot give you the wellness, there is some methods and there is some protocol is there, every human body should follow, then only they can reach up to the wellness. So I tried my best throughout my career, and still I am trying to message and to involve in the society, and I think I have conducted more than 50 campaign throughout the till now. And in the campaign also I have seen lot of changes, like if you talk about you know, free medical camp. Basically free medical camp people will do conduct for 1 day, so like that. So I used to conduct 5 days, 6 days, 3 days, like that. So my the intention is, if any poor people are coming, so our team will give the best result to the society, and that also already we got everything, and lot of cases, because that also unable to express, because it is a 13-14 years experience and 13-14 years result. But I can say one point, continuously we are giving the social service and we are promoting. We are not getting any funds from outside, everybody contributing, and it is a on sponsor, we are conducting everything actually. But people are, and all the society people are getting excellent result. We have all this data, we have all these testimonials and the physical data and the videos, everything. The patient, how they are happy and they are feeling good and they are improvised. I can say one example, like you know, migraine. It is it's really lifetime, life disorder, never be cured. Okay, so this type of migraine case also it cured within 5 days through the medical camp. So we try our best to give the good result to the society, and the society should feel, yes, this is a really healthy one and helpful to the human being, and we can get the result without any side effects. So Even if you talk about, we are the only organization in India and taking care for the society, and we got the best award for the largest and biggest acupuncture campaign in India, and that I thanks to all the team of the holistic healthcare, and we will try and we will continue till our the mission will be fulfilled, and this is the basic and point. And next the implementation is we are trying to set up a ethics committee. Then whatever the life disorder, if you talk about diabetic and BP and cancer, those kind of things will start the research with collaborate with the other organization, then only the impact will come to the society.
ఓకే సార్, మీరు మరి మీ ప్రొఫైల్ చూసినట్టయితే కూడా చాలా హెల్త్ క్యాంపులు నిర్వహించినట్టు మాకు తెలుస్తుంది. మరి సంవత్సరాల తరబడి మీరు సేవ చేస్తున్నారు సమాజానికి. అలాగే ఒక హోలిస్టిక్ హెల్త్ కేర్ ఆర్గనైజర్గా మీకున్న ఎయిమ్స్ అండ్ ఆబ్జెక్టివ్స్ గురించి మాకు కొన్ని వివరాలు చెప్పగలరు?
In 2008, when we are into the clinical research team, and I worked as a clinical trial coordinator in NIMS hospital and cancer department. So I discussed with several doctors, and I discussed with some NRA doctors also, and in that our holistic healthcare, and I worked with my colleague. Actually he is also a scientist, and apart from I have treated so many renowned doctors and scientists. So I calculated like how the impact will come to the society. Now if you talk about tobacco, government spending lot of money for the tobacco awareness. Okay, so is it really working? And if you develop some of the medicines or some of the any kind of, if you take, then your addiction will go? I think never.
Yes.
Okay, so basically every human being should understand their life actually. So I can say education is the most important nowadays, rather than taking any of the prevention medicines.
Yes.
Okay, if you educate well yourself, I think you can educate others and you can maintain your lifestyle actually. So I talked to several doctors regarding those kind of issues, and they have also taken in a seriously, and they are also planning to implement how to develop these things. And you know, the health crisis is everywhere, and if you talk about Indian history, it is very poor health conditions nowadays actually, and the prevalence rate also, prevalence rate day by day it is increasing. Lot of export, lot of science is there, and a lot of team, and but why prevalence rate is increasing? That is the number one questions.
Yes.
If diabetic, if we have a good medicines, we have a good export, then diabetics should not increase. Why it is increasing? So you know, diabetic, you know, pre-diabetic and the diabetic conditions. How to diagnose the pre-diabetic? If any organization they recognize this society, they are affected with the pre-diabetic, then there is the prevention. You prevent the pre-diabetic, then after some years we can stop the prevalence rate actually. There are several projects we can say. So as an organizer, and this is a big project, and we started the Lakshya Swasthya 2025. So according to the status of the some of the report from other organization, in 2025 India will be the capital of arthritis, capital of diabetes, capital of stroke, and capital of neurological problem. So you can say India is the capital of disease boom, like that. So how to control? Medicines can control, any therapy can control. This is the main idea of our team, and we are planning to implement. This is really very tough job, and I can say we have a three category: the prevention, education, and management. Management only those who are suffering with the chronic, all the chronic cases, and the prevention and the education, this is all the where people are feeling, say, I am feeling healthy, I should also take the prevention and some of the education regarding my life actually. So a simple example, we are our team is the member of the World Action on Health and Salt. So in the UK, so the UK department, they are doing a very good job actually. How to reduce the salt in our life? So there are like the some of the regular activities, we can say rice, white salt and the white sugar. It is a regular activities.
Yes.
It is not like that. So we are taking rarely or partially actually. So those lifestyle and we are involving regularly and we are addicted.
Yes.
Is it going to giving you health? Everybody should feel about this. Yes, I fond of rice, you fond of rice, but other hand, you are deducting your life actually, isn't it? So first upon, this kind of awareness should be there. And how to give the aware? So we are trying to maximum conducting medical program, and we are counseling actually each and every patient. And whoever the patient coming to me for the consultation, you know, I am giving the 1 hour time to the patient. I am spending the 1 hour with the patient, not for acupuncture, totally to change the lifestyle.
Awareness.
Total the awareness that need every doctor. If every doctor will take the responsibilities, I think one day it will change everything. Because you know the BP and BP, every house you will get the BP patient.
Yes.
Even small teens people are also they are getting BP. Okay. So when the BP is coming, then we are advising, please stop the salt. Why not before?
Yes.
We should take the before actually. So this is the project where we have to implement to educate the society, and I think I am trying to reach all this message throughout the India, and we make a big team throughout the India, and to promote this kind of things, how to change the lifestyle. And that is why we are working with the multi-therapy. We are not working with a single therapy. Of course, acupuncture is the very highlight point, and I can say in a single one word, when anybody takes the acupuncture will communicate with the physical and mental and social health actually, which is the basic dialogues and basic principle of the WHO guideline. So other therapy, what happen? If you talk about, we can say the allopathic can reach to the physical,
Yes.
can reach to the physical actually, but can't mentally, can't socially.
Yes.
Social, it is also, what is social health? People can ask the question, what is social health? I can give you one example. Some patient came to my clinic very long back actually. So actually he is healthy, but a lot of fearness, and the hands also shivering, like that, shivering, by talking also shivering. So just when one of the lady staff came to my cabin, and during talking to me, the patient, he was totally disturbed. I just imagine during the normal talking, and when the lady came to my cabin, then he disturbed actually. So then I undergone experiment everything actually. I have seen there is no problem, absolutely physical fitness, but mentally disturbed, and the most important is the socially he is affected.
Yes.
But nobody affected. That is the only problem. Sex.
Yes.
It is just like that. He is fear about the female sex.
Yes.
Okay, like that. So many people are there. Even if female also, if any male is coming to their side, they will fear. They will get the fear actually. The same thing. This is called as a social health actually. So you can't believe that problem. When I recognize he is affected with the social health, I have not given anything. Simply acupuncture. After 7 days, I have seen he sat with all this our staff, female staff, and he is joking and talking all this point of view without any fear. So that it is called as the impact of the acupuncture science, and how it work for in the social health actually. Earlier we can say for social health we can any of the holistic medicines we can use, and holistic healing we can say Reiki also we can give a good result those kind of symptoms, but only the needle treatment, the social also health can be removed. So that is why acupuncture, it is a very good communication with the physical, mental and social. When you start the treatment, 3 health you will get it. It's not like that you came for the headache, you only get the headache. No, headache problem will go. Apart from, he will take care of the entire body actually. So that is why it is the powerful holistic medicine. The acupuncture will treat the whole person, not a single symptoms.
Entire body will
Entire
be
body.
treated. Sir, tell me about your basic aim for your project.
Basic aim, we are trying to disease free society in future, and that is the actually basic aim, and in that we have to work lot of project actually, then only we can succeed and we can give the society in a very good health actually.
Okay, sir. How you are going to make a disease free society?
See, disease free, when you give the statement, the disease free society, so I think we are the only guideline. We have to guide the society actually, but if the society people can't change their lifestyle, so I think also it is very difficult. The point is we have to always counseling to the patient, modification of the lifestyle. Okay, so lot of diseases are there, chronic and acute. Why it is happening and in every human life? So there are lot of root cause for the disease actually. So I can say lifestyle and the stress, these are the common factor for every human being. So if every human being they will change their lifestyle, so we can make a disease free society. And you can say now the Narendra Modi, our Prime Minister, and he has taken care and approved the International Yoga Day. So if everybody is practicing like the traditional systems, if you talk about yoga, meditation and the Reiki, all these spiritual practices, so I think we can understand what is life and how to get the happiness from the life actually. If someone in stress, please avoid the stressful area actually, go to some other place where is nobody is there and no any different climate, very pure climate. Just laugh yourself.
Okay.
Just laugh yourself, then realize some energy is coming to your body. So my opinion is always the part of life. So what it is life exactly? Just listen yourself and please use yourself. If you listen yourself, use yourself, that impact will go to your family members, because they will also come to the point.
Yes.
Why? What is the basically key point he is maintaining like that actually. So this is the basic principle, and it is our project, no doubt, Lakshya Swasthya, but thing is it is a group of involvement, and it is depends upon the public response. If the public will respond to the lifestyle, how to modify and how to change, then one day everybody will see, yes, our lifestyle is changed and we are really happy. So everybody should involve in a holistic practice actually. If there is a holistic practice, I think we can say we can change our society and we can develop our healthcare sector actually.
Okay, sir. This is fine. And where is your hospital located?
See, the main register our center is in Kukatpalli, Hyderabad, and one branch in Odisha, Baleshwar district. So basically in 2 states we are maintaining our hospital.
Can you specify in your hospital successful cases, any successful cases?
Lot of success stories there within the 12 to 14 years, but some of the case which actually realized me, I am very fond of to practice the acupuncture. So day by day also acupuncture science also giving me shocked. Oh, how it in one day how it happened actually like that. So some of the case like that, and I can say in Hyderabad, people want to die. Okay, it is called as a anxiety, depression,
Yes.
want to die actually. So the thing is, to whom they will express their agony. If it unable to express, they will attempt.
Yes.
So luckily those person came to me actually. They express everything, okay, and they have given the testimonial. So before coming to here, I wanted to die. Okay, this is also social factor involved actually. Just cure within 5 days, without any medicines, simply with the acupuncture, it cure within the 5 days. And recently one of the case which is called as a C2, the cervical bone C2 C3 level, there is the severe compression and the spinal cord is totally compressed. Due to the spinal cord compressed, he totally just like a paralyzed. Okay, so the case was like for the AIMS Delhi. So one of my old client actually, he suggested the patient, and their entire family members, they are doctors, so they are planning for the surgery. They tried, but surgeon, they told, even if one of the very famous surgeon in AIMS actually, so he told, I can, but thing is there is no guarantee, because as it is near to the brain and the C2 C3 level, so what will happen the next after surgery, we can't give the guarantee actually. So that is why they have inquired and they came to me, and before starting the surgery, why not we should try for acupuncture, let us see, because doctor also saying after surgery there is no guarantee,
Yes.
maybe die or maybe the whole body paralyzed actually. So I discussed with all the doctors, because the point is it is a very serious case. So I may convince all the doctors what is the mechanism and how we are going to treat the patient actually. So basically I have given the 10 days. So it is due to the risk factor is there, I have given 10 days. I told just try for 10 days. If any improvement is there, then I think you continue for the long term up to the heal. So luckily the patient got improvement within the 10 days. So I have given some of the point like that. Apart from the acupuncture, we have to try some other therapy simultaneously. It will take long term, and as it is a very serious case, spinal cord is compressed. So I think when he came to our hospital, he came in stretcher.
Yes.
Okay. So after 5 months, now he is working, and he already left and discharged from our hospital, and now he is coming just for checkup every month. He is coming alone by the bus actually. So the entire family member and everybody, they are happy, and every time they are giving the testimonial. People, he is the only the major case before dying and came to the hospital and got the second life actually. So this is just recent case history,
Yes, sir.
and given the good result to the patient actually.
చాలా సంతోషం సార్. అక్యుపంక్చర్ ద్వారా మీరు ఎన్నో లైఫ్లు మరి కాపాడినట్టు కూడా మాకు అర్థమవుతుంది. ఇన్ని సంవత్సరాల సేవ మీరు చేస్తున్నందుకు ధన్యవాదాలు. అలాగే యాజ్ ఏ హోలిస్టిక్ డాక్టర్, వాట్ ఈస్ యువర్ ఫ్యూచర్ ప్లాన్స్?
Simple future plans. So everywhere the awareness is, all the organization they are creating. Actually we are planning to start the awareness, and what we are doing the awareness procedure. In that awareness procedure also we have so many implement is there, how to get wellness first of all. Once somebody fall with sick, so they are getting illness, and just they took some medicines or some other therapies, they are coming back to the health.
Yes.
Okay, but after health there is some wellness.
Yes.
So nobody is trying to how to get the wellness. So our my future plan is everybody should get the wellness, should feel happy and spread the happy, and this is a group of network A single doctor cannot do. Yes, whenever all the patient to me, I am trying according to. But we are trying to reach and to give the message the entire India actually. If everybody will follow some of the principles of our life actually, so I think one day everybody will see the changes, how the holistic science impact is going on, and how the holistic science can be improvised as a age category, like you can say for the children. So we have a specific implementation for the children actually, some protocol like that, and for the old age people. You know, the old age people, we are giving treatment, we are giving medicines.
Yes.
Whatever the system, it belongs to the healthcare.
Yes.
We are giving health, but no care. The care part is missing actually.
Yes.
So when it is old age people, care should be involved.
Yes.
Then medicine will work out, all the therapy will work out, because they need care actually. Okay. So this is also one of the biggest part actually in our project, how to care the old age people, because in the old age diabetic and BP and the knee pain and a lot of arthritis like that, different kind of, you forget about the disease.
Yes.
If you care the patient, there is no disease. Okay, this is one part of our project actually. Like that, we are involving a lot of project with different categories, not like the simple category. Now, if we talk about children, our part is who I am, nobody recognizes.
Yes.
Okay, the children should feel about who I am and what to do in future actually. Respect. Where is the respect? They have not respect to the seniors. They have no respect to the parents. Day by day when they are growing up like that actually. So this kind of thing we implement the Reiki. Reiki is a really principle. It will go something in a different way actually. So if all the children will practice the Reiki, it is a spiritual science. They can understand what is the life. They can understand, yes, what is my future. They can visualize actually. Okay, unless until you practice the spiritual science, you cannot visualize yourself actually, what I am actually. Every human being, every child is very special.
Yes.
But due to the unrecognition, we can say the coming to the what is the negative factor and the positive factor. This is the relation between our life actually. We cannot recognize ourselves. What is the negative flow is going on, what is the positive flow is going on. But once they will practice the healing sciences, they can make their flow in a positive way always actually. So like that we have different modality of treatment and project for different category, age category and sex category, like that. We have the women's care program, like the women's also they are taking lot of stress like that. So we have a separate project like that for how to take care of the women's all these problems actually. It is not that you can say in our health crisis, if you maintain or if you able to catch mental health and social health,
Yes.
I think physical is nothing.
Yes.
Mental is the main point actually. If you rectify to health actually, if you balance to health, the mental health cannot suppress two things actually. And always the mental health and your social health always superior to the physical. Once the physical health will be superior, then you will feel I am a diseased person, lot of problem with me.
Yes.
Once your mental health and social health will be strong, then you cannot imagine yourself something is happening to me, nothing is there.
Yes.
What is disease? No disease with me actually.
Yes.
I am really healthy. This is the message we want to send to all these society people, and we want to implement in future.
Yes. మరి డాక్టర్ గారు చెప్పినట్టు మానసికంగా ఆరోగ్యంగా ఉన్నట్టయితే మరి సామాజికంగా కూడా ఎదుగుదల ఉంటుంది. బాడీ అనేది దేనికి కూడా పనికి రాదు మానసికంగా బాగా లేకపోతే అని డాక్టర్ గారు చెప్తున్నారు. అదేవిధంగా ఇది ఫ్యూచర్ ప్లాన్గా డిసీజ్ ఫ్రీ సొసైటీని తయారు చేయాలని డాక్టర్ గారు ప్రయత్నం చేస్తామని చెప్తున్నారు. అలాగే సార్ మీరు చెప్పండి, యాజ్ ఏ డాక్టర్ వాట్ ఈజ్ యువర్ లైఫ్?
As if now I can say to the society, please kindly reduce the intake of salt and sugar. I think next you will see the difference in your life. So this is, I can say, lot of gas problem in the South India, lot of gastritis. If someone is taking sugar, how we can cure the gas problem? Isn't it? Because the sugar will aggravate and increase the gas problem. Okay. If there is the continuous process of the gas problem, then you will get the body pain, joint pain. That is why if you change your lifestyle, no disease will attack.
Yes.
Okay. So that is why my simple advice, as if now, please kindly reduce the intake of the salt and sugar.
ఓకే సార్, థ్యాంక్ యూ. మీ అమూల్యమైన సమయాన్ని మాకు కేటాయించి మా మెట్రో స్టూడియోకి వచ్చి ఆక్యుపెంచర్ సైన్స్ గురించి సమాజానికి ఎన్నో విషయాలు తెలియజేశారు.
థ్యాంక్ యూ.
మరి మళ్ళీ ఒకసారి మీకు ధన్యవాదం తెలియజేస్తున్నాం. థ్యాంక్ యూ వెరీ మచ్.
I also thank the entire team of the your studio and given me chance to speak about the holistic science and speak about the impact of the acupuncture science in India. So thank you very much.